Hello, I'm Dr. Anya. I am a clinical and somatic sexologist, and welcome to my virtual office. Today, I'm going to be talking about male sexual health and especially about conditions that result in difficulty in the bedroom, like erectile dysfunction, early ejaculation, performance anxiety, or even delayed ejaculation. So these conditions are very, very prevalent and very normal. And why I say they're normal is because at some point in time, most men will experience one of those challenges, whether it's some erectile dysfunction, here and there, if it's a little bit of eager ejaculation or a little bit of performance anxiety, most men at some point in time will experience one of those. And that's perfectly normal. Now, if you're experiencing something like that regularly, I know that it can be very challenging and frustrating to, you know, think of yourself as normal and to kind of let yourself off the hook. There's a lot of pressure that men have to perform a certain way. So this video is really for you if you're really suffering. And I wanted to start by saying that I really dislike the word dysfunction. So let's start with that erectile dysfunction. I really like to reserve that word dysfunction for folks who really have some kind of underlying issue like diabetes or hypertension. Typically, folks who have a true erectile dysfunction are never able to get an erection. Now, if you have something like that, it hope is not lost, and we'll get to that in a little bit. But generally, folks have what I like to call erectile variations. So, generally you're able to get like a morning erection, or when you're masturbating, when you're by yourself, you can get an erection, but it's really when you're with your partner that sort of challenge can come up. And that's why I call it erectile variations. Now, for what we call premature ejaculation or early ejaculation, I like to just call it eager ejaculation. So you're a little eager. Performance anxiety, we all of us have anxiety about different things at different times. And delayed ejaculation is definitely something that can happen for folks who, may have certain masturbation habits or whatnot. We can talk about that later. So, the main thing that I want to talk about today is what I call a mind body syndrome. So, oftentimes, you go to the urologist, you get checked out, everything looks fine. They're like, you know what, dude, it's probably related to stress. Maybe it's all in your head, meaning that you've just got a lot of work pressure. And this is a really true thing that happens in the body. Is there's this mind body connection. What's really important is that you realize that because it was, created in the mind or created in the brain, it can be uncreated. And even for folks who have the true erectile dysfunction, meaning that there's really nothing you can do about your erections because you have diabetes or hypertension, there's still a way that you can enjoy a healthy sex life and really maximize the mind body connection. So, we have something called neuroplasticity, which is really exciting. We say that the neurons that wire together fire together, or maybe it's the neurons that fire together, wire together. Either way, um, what's really amazing about the work that I do with men and the work that I do with all people, all genders, is that just because you have this going on, these things are wired, doesn't mean you can't unwire it and wire it to a different outcome. And so, just to really know that there is a mind body connection, stress is a big factor, unmet needs, emotions, unexpressed feelings, just all of the stuff of life, or what maybe it's called in Buddhism, dukkha, all the dukkha. And so, really, the process is to kind of look at all of that stuff, let it come to the surface, talk about your emotions, talk about those stressors, see if there's ways that you can take some of that stress off of your mind, off of your emotions, off of your life, and then also really maximize for pleasure. So, are you getting enough pleasure? Now, this is really specific for folks who have erectile variations. if you have a lot of stress kind of pushing on your brakes, but you don't have quite enough of, acceleration or gas on that other pedal, you can kind of stall. So we really want to take a look at that. Are you getting all of your needs met with your partner? And how can you ask for those needs to be met? Now, for folks with things like eager ejaculation, I have an entire thought process around that, which I call the multi-orgasmic male. I have a blog post on my website written about it. We can definitely discuss that. Performance anxiety is something that happens across the line, all genders. We deal with anxiety, and there are definitely ways that you can relax. And once you relax, then that sexual arousal system comes back online. So we can talk about that. Now, for delayed ejaculation, oftentimes folks have trained their bodies. So this is where men are watching porn and maybe edging and, kind of training yourself. You can train yourself into having a delayed ejaculation, so you can train yourself back. So that's the good news, is that there's so many great mind-body skills, and I'm happy to share more with you about that. Please reach out for any more guidance and information. Till next time, when I see you in the virtual office, have a wonderful day.